Have you ever heard of autoimmune thyroid conditions like Hashimoto's or Graves' disease? Well, they're actually quite common and can affect up to 15% of women and 5% of men. My guest on this week's episode of the IQ podcast is an autoimmune thyroid expert, and he's going to be sharing some of his best strategies using an integrative and functional medicine root cause approach. So be sure to tune in on this week's episode of the IQ podcast entitled Eye on Thyroid. Hello, 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 everyone, and welcome to another episode of the IQ podcast, where you can gain insights into vision health and brain health. I'm your host, Dr. Rani Banik, and today I have a very, very special guest who's going to come on and talk about a condition or a set of conditions which is fairly common across the world. And these conditions are thyroid conditions, specifically autoimmune thyroid conditions like Graves' disease and Hashimoto's disease. So I'm so excited to get into this interview because I always learn so much when I speak with this guest, and I'm sure you will too, all about the thyroid. So today we're talking about eye on thyroid. So I'm so excited to welcome my guest, Dr. Eric Ozansky. Dr. Ozansky is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has over 20 years of experience in health and wellness and has been helping people with thyroid and autoimmune thyroid conditions since 2009. He's the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, The Hyperthyroid Healing Diet, and Hashimoto's Triggers. He is also the host of Save My Thyroid podcast, which I highly recommend you tune into if you're interested in thyroid conditions. Dr. Ozansky was personally diagnosed in 2008 with the autoimmune thyroid condition known as Graves' disease, which we'll talk about. And after seeing how well a natural treatment approach helped with his condition, he began helping others with different types of thyroid and autoimmune thyroid conditions. So I'm so pleased to welcome my colleague and friend, Dr. Eric Ozansky. Thank you so much for coming on the IQ podcast.
Thank you so much for having me, Dr. Banik. Really excited to be here.
Yeah, I've been looking forward to this conversation because, again, every time I speak with you, I always learn so much. Really, we get deep into some of the intricacies of natural healing for thyroid, and it can also be used for other autoimmune conditions as well. But before we get into some of those details, I would love for you to share your story of how you got interested in this particular topic and also how you got interested in functional medicine, which is something that we are both that we both practice. We're both certified functional medicine practitioners. So please share your story with us all.
Sure. So my background's a chiropractor, and even as a chiropractor, like a lot of chiropractors for this continuing education credits, they would take chiropractic seminars. I would always take nutrition and functional medicine seminars. So even before I was diagnosed with Graves, I still had a passion for nutrition. Honestly, really didn't incorporate though the nutrition, functional medicine as much in my practice. Still was mostly just practicing conventional chiropractic. But then one day, before being diagnosed with hyperthyroidism, I was dieting, detoxifying, losing a lot of weight, and didn't attribute it to the hyperthyroidism, probably because initially it wasn't related to that. But over time, I was losing a lot of weight, had some of the symptoms, but it wasn't until I was walking around in a retail store, a Sam's Club here in the United States, and took my blood pressure out one of those automated blood pressure machines. My blood pressure was normal, but my resting heart rate was elevated. It was around 90. I manually took my my heart rate the next few days, and it was anywhere between 90 and 110 beats per minute. And then I knew something was up between that, the weight loss, and some other symptoms. Went to a primary care doctor, had some blood testing done, was diagnosed with Graves hyperthyroidism initially, and then eventually went to an endocrinologist and got the antibodies done, was diagnosed with Graves' disease. And then again, based on my CE credits and a few of them were related to thyroid health, a couple of functional medicine seminars related that focused on the thyroid, even though I didn't have any personal experience taking a functional medicine approach when it comes to Graves. At that point, I figured, hey, that's what I believe in. I'm going to give it a try. And of course, that's what we're going to talk about here. It was successful. I was able to get into remission. I've been in remission since 2009, and since then been helping others with Graves, Hashimoto's, and even some non-autoimmune thyroid conditions as well.
Yeah, it's wonderful how you were able to use your training in nutrition, functional medicine, and apply it to your own health journey. And now you've inspired so many others to do the same. So it's really, we're also lucky to have you as a practitioner, but also having your insights, having the disease itself. So, can you just, for our listeners, can you just very briefly first describe what is Graves' disease? Like you mentioned some of the symptoms that can happen, but based off of your experience and also what other people may have with Graves' disease, what are some of the symptoms that can happen?
Sure. So with Graves, again, you have an elevation of thyroid hormones, and the main thyroid hormones, at least those that can be tested, T3 and T4, with T3 being the active thyroid hormone. And when you have that increase in thyroid hormone, typically you'll get cardiovascular symptoms such as that increase in resting heart rate that I experienced, heart palpitations, very common. I did experience some tremors. And then I mentioned weight loss. I lost 42 pounds. Now, not everybody loses weight with
Mhm.
Graves, but a lot of people
Mhm.
do lose weight. So there's the weight loss. Some people experience anxiety. Some people experience increased bowel movements, frequency, as well as loose stools, diarrhea in some cases, and insomnia. Hair loss is pretty common. And then, as you're familiar with, you are on my podcast talking about thyroid eye disease, which is associated with some cases of Graves' disease as well. So,
Mhm.
but yeah, so those are some of
Yeah.
the more common signs and symptoms associated with
Yeah, so
Graves.
just listening to that, I know that, some of those symptoms may be initially non-specific, but when you put them all together, when you put all the pieces of the puzzle together, it starts to kind of have this picture of Graves' disease. And the eye changes can certainly happen. And we actually have a whole separate podcast episode on thyroid eye disease. So if anyone's interested in thyroid eye disease, please tune into that episode. Thank you for explaining about Graves' disease. Can you now just explain what is functional medicine? Because I mentioned it, you mentioned it.
Yeah, I mean, just to make it simple, functional medicine is all about identifying and treating root causes. It's trying to find, address the underlying cause. When you go to a conventional medical doctor, again, there's a time and place for seeing a conventional medical doctor. But if you come, I mean, again, for
Mhm.
the case of Graves or Hashimoto's, typically their goal is symptom management, which is very important. If you have Graves' disease, you definitely want to manage the symptoms, and we could talk more about that. But they don't do anything typically to find out why did you develop the autoimmune
Mhm.
component in the first place. With both Graves and Hashimoto's, functional medicine looks to identify the different imbalances, whether looking at the adrenals, looking at the gut, looking at one's toxic load, and then trying to do things to address those underlying causes, other
Yeah.
underlying imbalances.
Yeah. So the way I typically explain it is conventional medicine is designed to really diagnose a problem and then to put a band aid on it with whether it be medications or surgery. Whereas functional medicine is to try to get underneath the problem and figure out where is it coming from and address it from its root cause. And you mentioned earlier about, the testing for Graves' disease. I'd love for you to share, what is the difference between just regular hyperthyroidism and Graves' disease, and what are some of the tests that need to be done to really confirm either Graves or another autoimmune thyroid condition, which you mentioned, which is Hashimoto. So, what are the tests that people should be getting? And if they're not getting them, what should they be asking for?
Yeah, great question. So, looking at a thyroid panel is probably the first step that most people will take. And it's important to mention that a lot of people will just get the TSH tested, thyroid stimulating hormone, which is a
Mm-hmm.
pituitary hormone. And with hyperthyroidism, typically that hormone is depressed. And the reason for that is because the pituitary gland needs to signal to the thyroid gland to create more thyroid hormone. But in the case of hyperthyroidism, you don't want to do that because you have too much thyroid hormone. So with hyperthyroidism, you'll get that decreased TSH. On the other hand, with hypothyroidism, Hashimoto's, you'll get an increase in TSH because you want the body to produce more thyroid hormone. So besides looking at the TSH, you want to test the thyroid hormones. T3, T4. I like looking at the free T3, free T4. There's also total T3, total T4 as well. And then there's antibodies and so the antibodies, those are what differentiate autoimmunity from non-autoimmunity, or at least
Mhm.
one of the main ways. So, for example, the antibodies associated with Graves are thyroid stimulating immunoglobulins, or TSI, which is a type of TSH receptor antibody. And they could
Mhm.
also test that too, TRAB, in most labs. And then when it comes to Hashimoto's, thyroglobulin antibodies are related to the Hashimoto's.
Mhm.
And then there's thyroid peroxidase, or TPO antibodies, which are more closely associated with Hashimoto's, but also very common in those with Graves' disease. And so if someone has, let's say, hyperthyroidism with the positive thyroid stimulating immunoglobulins, then that typically is diagnostic of Graves. If someone has elevated TSH along with thyroglobulin antibodies and or TPO antibodies, and that's typically diagnostic of Hashimoto's. And if someone doesn't have the antibodies, then it's possible they could have false negative antibodies, but most of the time we're looking at a non-autoimmune condition. And one other mark I should mention, reverse T3, which is the inactive form of
Mhm.
T4, which some practitioners test. I test it for those with Hashimoto's. With Graves, usually we're going to see reverse T3 elevated, not really
Mhm.
giving us much information in those with hyperthyroidism Graves. But yeah, that essentially is so. Again, with Graves, low TSH, elevated thyroid hormones, positive thyroid stimulating immunoglobulins. Hashimoto's, elevated TSH, thyroid hormones might be low, but they might sometimes they're normal or like less than the optimal range. And then again, you'll get the elevation, either thyroglobulin antibodies and or those TPO antibodies.
Oh, wow. Thank you. Thank you for those that summary, because I think it's so important for people to understand what's being tested. And many times, if I suspect a patient may have a thyroid condition based on their eye exam, I'll ask them, "Have you had your thyroid checked?" And many of them will say, "Yes, my doctor did it during my annual checkup. They checked my thyroid. They said it's fine." Usually, though, the test that's checked is only the TSH. And so if you suspect that something's going on, that you may either have hyperthyroidism or hypothyroidism, perhaps even an autoimmune form of either of those two conditions, you really do need to ask to get all the thyroid hormones checked as well as the autoimmune panel, because the regular TSH alone is not enough information. So keep that in mind. And also, you have to advocate for yourself. I've had patients who, their doctors have been very hesitant to order these tests, but the patients are very insistent. And then lo and behold, there's a diagnosis that's uncovered because the tests were done. So don't be afraid to ask for it if you suspect that something's going on. So, Dr. Ozansky, when you first see a patient with a known diagnosis of autoimmune thyroid disease, what are some of the things that you investigate when you're thinking about root causes? Can you give a few examples of what some of the root causes may be, and perhaps some of the testing that you do to identify those root causes?
Of course. So food is important. Eating a healthy diet is important, and gluten, when it comes to not just Graves and Hashimoto's, but autoimmunity in general, is a potential trigger. Not only potentially a direct trigger of autoimmunity, but can affect the permeability of the gut, cause a leaky gut, which is a factor with autoimmune conditions such as Graves and Hashimoto's. A big one is stress. Stress was huge when I was dealing with Graves' disease. I was in denial though. I mean, I knew stress was big, but I thought I was doing a good job of managing stress.
Mhm.
But then one of the tests that I did was an adrenal saliva test that looked at the circadian rhythm of cortisol. Cortisol
Mhm.
should normally be at the highest levels in the morning and gradually decrease during the day and be at the lowest point at the end of the day. So that's the advantage of doing a test such as a saliva test. So there's also dried urine testing, with the Dutch
Mhm.
test being one of the more well-known ones. And where if you do a blood test for adrenals, they're just doing a single cortisol sample, maybe looking at the DHEA. But so I do like looking at the adrenals. I
And
mentioned.
you're looking at the pattern over the day, the circadian rhythm of cortisol release. And what
Exactly.
happens with stress? Like if someone's very stressed, what type of pattern do you typically see? Instead of that high cortisol in the morning, what's the typical pattern?
Yeah, well, I mean, you still might see high cortisol in the morning, but you might see it above the range, the cortisol. It depends on the person, the stage of there's like different stages. So
Mhm.
initially cortisol may remain high, but when I dealt with Graves, everything was low. So I had low cortisol. My morning cortisol was low. My DHEA was low. And that's the so-called what they call like an adrenal fatigue pattern. Others will
Mhm.
say it's just dysregulation of the HPA axis, hypothalamic
Mhm.
pituitary adrenal axis. But yeah, so we're looking to yeah, ideally you want it high, but within the range in the morning high, and then gradually decrease. But in some patients, we'll see it above the range. Now, if it's really high in the morning, we also need to ask the person, was it a normal morning or was it abnormally stressful? Did you have a
Mhm.
headache? Did you have an argument with your spouse? Because that's the limitation. There are limitations with this test when it comes to looking at cortisol. And that's why when doing it in the lab, like getting a blood test, the limitation is some people get stressed out about getting a blood test, so that can spike
Mhm.
up the cortisol. So there are different variables, but same thing. Even if you're doing it in your own home, if you're stressed out that morning, that could artificially raise
Yeah, so it
cortisol.
may not be
Uh,
the best situation to get the test done. So you want to kind of be in your
exactly,
steady state when you're doing the test.
exactly.
Oh, that's so important. Now, what about heavy metals or toxins? Have you found those to be potentially root causes of autoimmune thyroid conditions?
Yes, I mean those definitely can be factors, and there's different ways of testing for them. There's hair testing, there's urine testing. Blood testing usually is looking more for acute exposure of heavy metals, whereas hair and urine more chronic exposure. But mercury, I mean, when it comes to the literature, mercury is definitely a culprit when it comes to both thyroid autoimmunity, as well as potentially directly affecting the thyroid. When it comes to other heavy metals, there's not research with, like, for example, aluminum. I like to do hair testing. I like urine testing too, but hair testing, a lot of people come out positive for aluminum, like high in
Mhm.
aluminum. Now, there's nothing in the research showing a relationship between aluminum and Hashimoto's, aluminum and Graves, as far as I know of. But aluminum is an immune stimulator. They use it as an adjuvant in some vaccines. And again, I guess the lack of research doesn't mean it can't be a factor. And that goes for other heavy metals like cadmium, lead, arsenic.
Mhm.
So yeah, I definitely would say that these heavy metals can be big factors, as well as we both know we live in a toxic world. So it goes beyond the heavy metals. We're exposed to so many different environmental toxins,
Yeah, from all of our
xenoestrogens.
personal care
Yep.
products, our cleaning products, the additives in foods. I mean, we're surrounded by chemicals, right? And some of which are fine, and others may not be well tolerated. I just wanted to ask you so, the tests that you describe for this functional medicine approach, a lot of them are not blood tests, correct? Like, for example, you mentioned urine testing, saliva testing, hair testing. So, how would one get these tests? Because they're not typically done by conventional doctors, right? So,
Yeah, great question. So usually you'll want to see someone who practices functional medicine. I mean, some people you might be able to get some of these tests on your own, but then you're stuck with trying to interpret them on your own.
mhm.
So I'm going to be a little bit biased because just like you, we're both functional medicine practitioners. So yeah, typically if you ask a conventional medical doctor to order these tests, usually they're not going to order. I mean, sometimes they'll do a saliva test for cortisol, but as far as some of these other tests, like comprehensive stool tests, which we didn't mention, usually they'll just do a very basic stool
Mhm.
test if they do that at all. So yeah, to answer your question, you would want to go ideally to a functional medicine practitioner to get these tests done.
Yeah, thank you. And also, if anyone's interested in finding a practitioner, there's the website, ifm.org, and that's basically Institute for Functional Medicine.org. And you can put in your location and you can get a list of providers in your area. So it's a great resource, that website. We are back with our discussion, Eye on Thyroid, with my special guest for this week, Dr. Eric Ozansky. So, Dr. Ozansky, you had mentioned earlier when we were talking about potential root causes, you mentioned very briefly diet and you mentioned gluten. Are there any other foods that may be culprits when it comes to potentially triggering autoimmune thyroid conditions?
Yeah, gluten is the big one. Corn is overlooked. That's actually, there is research showing that it can cause a celiac immune response similar to gluten in some people. So, corn is a big one that we recommend to avoid.
Sorry to interrupt you, but it doesn't matter if it's non-GMO, it's still potentially triggering for an autoimmune condition.
Yeah, that's true. Even besides the fact that most corn is genetically modified. So if you do choose to eat corn, ideally you want to eat organic, certified
Mhm.
organics corn. But yeah, besides that, it's a common allergen. So that is a good question. So corn, in addition to gluten, dairy, and some people could be a pretty big trigger. And I mean, as far as other foods like nightshades, I wouldn't say will I don't know if you'd really call it a trigger, but can affect the permeability of the gut in some people. And some people could be inflammatory. Nightshades, tomatoes, eggplant, white potatoes, peppers.
Mhm.
Again, they have some great health benefits too. So I'm not saying to exclude them permanently, but while healing, I do recommend at least initially to take a break from nightshade foods, from the nightshade family. And I mean, those are some of the. I mean, there are when it comes to diet, I do recommend for Graves and Hashimoto's commonly an autoimmune protocol or an AIP
Mhm.
type diet. And again, it's just a starting point. I mean, some people will struggle and they might do better on just a regular paleo diet because, for example, an AIP diet excludes eggs, whereas a regular paleo diet allows eggs. And again, I can't say
Mhm.
eggs are a common trigger of the thyroid, but again, some of the compounds in eggs can affect the gut potentially. And eggs are a common allergen as well. So, like when doing any type of elimination diet, even if it's not AIP, typically eggs are excluded, even though a lot of people eat eggs, including myself. But
Mhm.
again, so it really when it comes to food, those are the triggers. But really, I think we would both agree whole healthy foods is important. This is getting to a different topic. So I don't know if you want to talk about the diet portion in relation to or separated from the potential food triggers. But again, that
I
I
do
was
have
just
a question about some of the diets that you mentioned. Like, if you start someone on an autoimmune protocol diet or therapeutic diet, is what we call it in functional medicine. Um, how long should they stay on that diet? Is it for a limited period of time? Is it for extended periods of time? What do you usually recommend to your patients and clients?
yeah. So for an autoimmune protocol, typically about 3 months is what I would
Mhm.
recommend, but it depends on the person. Some people, I mean, if they're really struggling after 30 days and they're stressed out about the diet, then we'll have them reintroduce food sooner. I mean, it's ultimately up to the person. And then on
Mhm.
the other side of the spectrum, if someone after 90 days, they're thriving and they're like, you know what, I just want to follow it for a little bit longer. Again, doesn't mean like a year or two, but some people might follow it for 6 months just because they're feeling really good after 3 months and they want to
Mhm.
continue it while they're healing.
I want to add two things, two comments to that. Why is it 3 months? Um, so, just from an immune standpoint, the immunoglobulins that circulate in our blood typically circulate for about 3 weeks. But the blood cells that make those immunoglobulins circulate, their lifespan is about 3 months. So, with this type of diet, you're hoping to kind of wait until the next generation of blood cells repopulates so they're not having that immune trigger. And then the second thing I wanted to mention is that not all diets are for everyone. So some people, they may start a diet and not feel so great on it. So if you're really not feeling well, then talk to your provider and maybe you need to tweak it a little bit. And then some of my patients, when they do go on some of these diets, they feel like they're very restricted in their eating habits. It makes it very difficult. So I do let them slowly reintroduce foods, but only one at a time. So they're not reintroducing everything all at once. You're doing it one at a time, almost like a little experiment to see what you may be triggered by if you're having any flare of your symptoms by reintroducing maybe one food a week very, very slowly. So that's typically how I do it. I'm not sure, Dr. Ozansky, if you have like a similar type of approach, but that's what I found works best.
Yeah, I agree. When it comes to the reintroductions, to reintroduce one food, typically I recommend every 3 or 4 days. And then if all goes well, reintroduce the next food and hopefully everything goes smoothly. But if not, then they might have to, they react to any food, then they'll have to avoid that food for a period of time. But
Mhm.
yeah, definitely agree with the slow reintroduction of foods.
Yeah. And how often do you actually do food sensitivity testing, like formal testing for your patients? Is that first line or is that second line in your practice?
Yeah, it's not first line. I know every practitioner is different. There are some that will recommend food sensitivity testing on every patient. So my approach over the years has been to start with an elimination diet and then do some of the other testing we mentioned and then see how the person progresses. And if usually I'll recommend food sensitivity testing if the person isn't progressing as
Hmm.
expected, so it's not something that everybody gets, or if someone absolutely wants to get a food sensitivity test, if I'm speaking with them during an initial consultation and I'm getting a feel that they really want to do food sensitivity tests, because they could do both. You could do an elimination diet, like an AIP type diet, and do a food sensitivity test as well. You just need to be careful if you do like IgG food sensitivity test, you want to get the blood sample before you start eliminating foods, because as you
Hmm.
know, if you eliminate certain foods for a period of time, then that test won't be valid because you will stop producing the antibodies that
Hmm.
the test is measuring.
No, very important points. Thank you. Thank you for clarifying that. So, I want to move on to another interesting topic. We've been talking a lot about thyroid and root causes of thyroid issues. Now, the thyroid seems to be very intimately involved with another organ system, which is the gut. So, can you share with us a little bit about the thyroid gut connection and what's been your experience in managing this, thyroid gut connection?
Yeah, so obviously the gut is very important. Most of the immune system cells are located in the gut. And so you need a healthy gut to have a healthy immune system. And I mentioned a few times that increase in intestinal permeability, which is the medical term for a leaky gut.
Hmm.
And there's what's called the triad of autoimmunity, which involves three components necessary for autoimmunity to develop: genetic predisposition, exposure to one or more environmental triggers, and that leaky gut. So you
Hmm.
can't heal, really, you can't heal the body without healing the gut. And also certain microorganisms can be a factor in like H. pylori, parasites can sometimes be potential triggers of Graves, Hashimoto's, or maybe not direct triggers, but affecting again that permeability of the gut, cause that leaky gut. Other factors like SIBO, small intestinal bacterial overgrowth, or a candida overgrowth also could affect permeability of the gut. So you want balance. You want, and you could
Hmm.
do a lot of that through diet, eating a healthy diet, plenty of fiber rich foods, plant based foods. And I mean, even stress will have, like chronic stress could have a negative effect on the gut microbiome. So, blocking out time for stress management, reducing your toxic load. So, a lot of diet and lifestyle factors can help to improve the gut microbiome. I mean,
Hmm.
that being said, there is a time and place for things such as prebiotic supplements, probiotics,
Hmm.
digestive enzymes, and other gut healing agents.
Yeah. So it seems like what you're saying, Dr. Ozansky, is so people can try to optimize their gut health by DIY interventions. So diet, lifestyle, stress, perhaps eating live probiotics or taking a probiotic, a prebiotic supplement. But there comes a point at which those interventions may not be very effective. And so, at what point should people seek out a functional medicine practitioner to help guide them through healing their gut? Because there's a protocol, and we've learned it in our training in functional medicine. There's a 5R protocol, and it's quite involved. So, at what point do you recommend patients may want to seek out someone who can guide them through this journey?
Yeah, well, I mean, one obvious situation is if someone has a lot of gastrointestinal symptoms and it's not resolved through diet. So if they are making dietary changes, eating whole healthy foods, and they're still experiencing those digestive symptoms, then we might need to do a comprehensive stool test or maybe do a breath test for SIBO, small
Mm-hmm.
intestinal bacterial overgrowth. Another scenario is if someone's not symptomatic, but they're still not getting better, because you can't always go by symptoms. You could have a underlying gut issue without experiencing symptoms.
Mm-hmm.
So if someone's not progressing, and if you haven't done any gut testing up until that point, then maybe you want to again do maybe not a SIBO breath test, because I find with most of the time with SIBO you will get the symptoms, but maybe do a comprehensive stool test,
Mm-hmm.
and that's part of that remove portion of the 5R protocol. So like what are you going to find if you already removed the food but you're not getting the change? Again, is it some type of microorganism or something else, some other factor? So yeah, we could on our own we could incorporate the other facets of the 5R protocol, even though again it does help to work with the practitioner. But I think a lot of times we overlook that first R, the remove component, and and people are just randomly taking probiotics and digestive enzymes and gut healing supplements such as glutamine, which all could be beneficial. But if you haven't removed the factor that's causing the gut dysbiosis, that's causing the leaky gut, then again, it's going to be really difficult to heal.
Yeah. We've talked about the 5R protocol. Could you just explain what it is very, very briefly? I don't want to spend too much time on it, but just in case anyone's interested, what do the 5R's stand for in this gut
Sure.
protocol?
Of course. So the first R is remove. So again, remove food or microorganisms, anything that could be disrupting the gut. Two is replace with things like digestive enzymes, trying to increase stomach acid, even dietary fiber. Third R is re-inoculate with prebiotics and probiotics, both
Mm-hmm.
food and supplemental sources. Four is repair. So things like drinking bone broth or cabbage juice, or again, gut healing agents such as L-glutamine,
Mm-hmm.
aloe vera. And then five is rebalance. So rebalance the parasympathetic nervous system, which plays a really important role when it comes to gut health. And I'm sure you spoke about the vagus nerve and other episodes. But yeah, just like even like again, the stress management we spoke about early on, that could go a long way when it comes to rebalancing. Getting sufficient sleep, of course, very important. So
Mm-hmm.
that in a nutshell is the five R's of the 5R protocol.
Thank you for sharing that. And this information has been so invaluable. I'm sure that many of our listeners, whether they're potential patients or providers, will really benefit from what you shared. So we're just about done with this week's episode of the IQ podcast. But are there any last minute comments or words that you'd like to leave the audience with today, Dr. Ozansky?
Well, just that there is hope, and again, there's a time and place for thyroid medication. A lot of my patients are on medication, like those with hyperthyroidism. There are natural approaches, but there are people that I work with that they're on anti-thyroid medication for hyperthyroidism and for Hashimoto's, those who are on thyroid hormone replacement. But as we've discussed, you always want to try to address the cause of the problem. And I'll leave it at this. If your endocrinologist says that there's nothing you could do for the cause of the problem, that diet doesn't play a role, again, just keep in mind they don't have that functional medicine background. That's what they were trained to. That's what essentially they learned in medical school. So definitely seek out the advice of the functional medicine practitioner, because there always is a cause. There always is an underlying cause. And again, there might be multiple triggers, not just one. So it could be challenging. I'm not saying it's easy, but it's definitely worth taking the time and working with an expert, working with a functional medicine practitioner to try to find those underlying triggers.
Yeah, those words are gold, Dr. Ozansky. Number one, there's always hope. So never give up hope, and, find a provider who resonates with you and who's willing to dive deep and help you uncover triggers and guide you through this journey. It's really best if you have a partner, and try not to do it all on your own. It can be a little bit overwhelming if you try to do it on your own. So thank you so much for being our guest today on the IQ podcast, Dr. Ozansky. What are some ways, if people wanted to reach out to you, learn more from you, perhaps become a patient or a client, what are some ways they can contact you? And also, please share, you have a very exciting event coming up soon, so please share more information on that as well.
Oh, yes. Thank you. So my website, so I have a few websites. My original website, naturalendocrinesolutions.com, where you can find hundreds of articles related to Graves' disease, Hashimoto's, non-autoimmune thyroid conditions as well, and SaveMyThyroid.com. So that's 3 years old as of recording this. That's where you could my podcast. You can find my podcast, or just visit Save My Thyroid on your favorite podcast platform. And then I have a few books related to thyroid health that you could find on Amazon. So I have a couple related to hyperthyroidism, one related to Hashimoto's called Hashimoto's Triggers. And then I have a thyroid summit coming up. It's called Save My Thyroid. So you could check that out by visiting SaveMyThyroidSummit.com. And those are some of the main ways that you could find out about me. And thank you, Dr.
Wonderful.
Banik.
Thank you. We'll have all those links in the show notes, so you can find all the resources there. It'll be easily accessible. And definitely tune into the summit that Dr. Ozansky is hosting. He has over 30 amazing expert speakers, and he's done some amazing work with this summit, and he's going to help so many people. So I'm really excited for it myself. Well, thank you again, Dr. Ozansky, and thank you all for joining us for this week's episode of the IQ podcast. I will see you all next time.